Every woman deserves this kind of care.
Midwives specialize in natural births. And how
We
you
do.
Right?
Yeah.
Okay.
Natural births, water births.
Can we talk about pain during labor?
Oh, as a midwife, I have hundreds of little tips and tricks that can help you.
If you have a big baby, we have to go for a C-section.
It's false.
Baby's heart rate is dropping, we need to do a C-section.
Dropping when, dropping how.
Umbilical cord is around the neck of the baby.
False.
It's a breech baby, we need to do a C-section.
False. Breech vaginal birth is a skill that most obstetricians nowadays don't have.
Our baby has pooped inside.
Oh my gosh, yeah, this is like...
Welcome back to Matcha with Mama. If you're planning on giving birth in India, you absolutely need to hear from our next guest. I promise you, she's about to transform the way you think about pregnancy and childbirth. She's not just experienced, she is phenomenal. This incredible woman was a crucial part of my own birthing team when I had the privilege of giving birth at home. And get this, she's already been a guiding light through an incredible 142 births and counting. Please give a warm Matcha with Mama welcome to the truly remarkable Chetna.
Welcome, Chetna.
Hi, Deepika.
The goal with this episode is to make as many people in India as possible to have a midwife during their pregnancy, postpartum, and birth.
I love that goal.
Okay, so let's dive right into it.
Okay.
For somebody who's never heard of a midwife, how do you differentiate a midwife from a nurse, and what is your role exactly?
So as a midwife, I'm an expert in physiological birth. And what does physiology mean, right? So it means a normal, natural function of the body. That's what midwives study, really. Nursing is a more general term for, like, nurses work in all sorts of departments and not just birth, right? And we do have specialists, doctors who are obstetricians, who are specialists in birth, but they handle complications, really. That's their main job. So a midwife is neither a nurse nor a doctor.
If I had to explain a midwife in my birthing journey, I would explain as a fully professional certified doctor who is actually my mother. So she would not want anything bad for me.
Yeah.
And give me all the time in the world, answer all my questions.
Yeah. I think you've summed up the essence of midwifery care very beautifully. Like, we are focusing and we are so present for our clients, and we do go the extra mile in supporting them because, as a midwife, I strongly believe that, every woman deserves this kind of care, right? And when you feel respected and when you get this kind of compassionate motherly love and care with the added clinical skills and the professionalism that we bring, right? As a midwife, one of the things that we learn, and even through my experience, what I have seen is that we are always prepared for the worst, but we are expecting the best, right? And the underlying assumption is that, we are inherently made for this. We have the innate ability and also the blueprint or the DNA and the wisdom, the age-old wisdom in our own bodies to give birth. Because a lot of women who come to me have had a baby already, and they've had either a not so satisfying, sometimes even a very traumatic experience, or they've ended up with a C-section, which they have later researched and realized that it wasn't even necessary. And C-section is a major abdominal surgery, right? So you want to kind of prevent that from happening as much as possible. So people do seek a different route the second time around. I think what I would like to raise awareness about is that you don't even have to, wait for the second time. Choose it the very first time. At least explore that option at the very first time.
Right. Midwives specialize in natural births. And how
we do.
Right?
Yeah.
Okay.
Natural births. We also support women have water births, right? And women can eat and drink and move. The environment that they are in when they're birthing is quiet, they're dim lights.
How is it different from an obstetrician?
Most obstetricians I know work in hospital settings, and hospital settings have, very clinical rooms, and which are great for sorting out and treating other people who have diseases and who need like surgeries and those kind of things. But 85% of women can give birth normally and naturally. So they don't need that kind of a clinical sterile environment. And there has been a lot of research that shows that having this kind of an environment which is cozy, home-like, having people around whom you know and trust, that goes in such a long way in helping that natural birth process unfold, because that's how you can actually support the hormones that are required to bring the baby into your arms.
Okay. How can a pregnant woman and her family find a qualified midwife? So what are your qualifications?
Specifically in the Indian context, we don't really have the kind of courses that I have done. I'm a certified international midwife, and I did my certification from an organization in the US called as International Registry of Midwife. However, I did all my coursework and all my training here in India. So there are not too many midwives who have the kind of training, skill and experience that I have. We of course have a lot of traditional midwives who still attend births in many rural and semi-rural, semi-urban settings. We also have a cadre of nurse midwives who the government is training. Nurse midwives, however, work with doctors and they don't have full scope of practice like I do. So I can take care of women right from 6 to 8 weeks of pregnancy all the way, support them in labor and birth, as how you would like the kind of care that you're seeking from, say, a doctor. That's the kind of care that I can provide, right? But again, the main difference is a doctor is looking to support you during complications, right? Because that's their whole learning. Whereas I learn all about how to support the natural process, and in case there are deviations, small deviations from the natural process, like for example, the baby's position. So I work with the mom. There's something called as birth biomechanics. So I work with her in bringing a balance and alignment in her body so that the baby can get into a good position and then the birth can unfold. So we actually are studying, things like nutrition, right? Because nutrition can go not just making your baby really healthy and strong, but also in creating the conditions for your body to work like it should be. So you have enough hormones, you have enough strength and resources on board to go through, labor and birth, because it's hard work, right? So these are very specific, specialized areas that midwives, learn about.
What are the biggest misconceptions or fears that Indian families have while considering to get in touch with the midwife?
So I think most people still think that midwives are traditional midwives, where it's the dais, right? So that is the thing that occurs to people when they hear the word midwife for the first time. I am a modern midwife, and whatever is there in modern obstetrics and also the modern medical care, we have taken all the good things and applied to it while retaining that essence of supporting the woman, one-on-one support.
What kind of prenatal care does a midwife provide that specifically prepares a woman for a natural birth?
So in terms of the schedule, right, throughout your pregnancy, you see a doctor, you would be seeing a midwife. I think there are many, many differences. I spend an hour, sometimes 2 hours with each client, right? And the idea is like throughout their pregnancy, and the idea is to build a relationship with them so that they feel that they know that, I have their best interests in mind, their babies, and also they can ask me any questions. I follow what is called as informed decision making, which means that my job is to provide you all the information, to provide you all the choices that you have to make that decision, to answer any questions. Then you get to decide, because we treat parents as very capable, critical thinking, and in this day and age of information being available at our fingertips, I think we have to change how we are providing care as well, right? And doctors or anyone, any care provider scolding, don't Google because I'm the expert here. I think midwives believe it the other way around, that you are the expert in your body and in your baby. And you can definitely Google, but then I'll also bring in my information and my expertise and my skills to the table, and we can see how best we can support you through your whole journey.
I want to highlight here because I've gone through the traditional route of going to a gynac and then shifting my care to, midwife. It was so different. Firstly, the time that I got with the gynac was 5 to 10 minutes maximum. With you and your team, I got an hour, sometimes 2 hours to answer all my questions. Secondly, whenever I tried to ask any question to the doctor, she was very, how dare you ask me? And very defensive.
Very defensive.
Very. And my husband and I, we are very curious people, right? And
you're very well researched people, I should say.
And also we want to know, okay, why are you recommending this medicine, right? And after 1 or 2 appointments, I stopped asking questions,
right?
Because she was the best out there. I don't want to lose my doctor. I don't want to really, bother press her the wrong way because she's going to deliver my baby.
Exactly.
You guys were completely different, and I felt like you had the entire knowledge. So I've had a home birth, right? That was also very last minute when my water broke.
It was.
As an individual, I would never imagine having a home birth, to be honest, because I want a hospital setting. That's where my, somehow I felt safe. So I was like, okay, I have all the equipment if I need, right? And that's where I'll give birth. In the last minute, somehow, because of the situation, I decided to have a home birth. And fortunately, I did, because it has transformed, how I see birth and just life in general. But I do believe that a lot of other women out there want to have births in the hospital. So if they choose that route, can you still be a part, or can a midwife still be a part of their journey?
I mean, if you see in a lot of countries, midwives do work in hospital settings, right? Here in India, it's kind of a unique situation where you need to have some kind of a collaborative model happening. And I work with obstetricians and nurses all the time. I really hope that hospitals are more and more open. And I think if you as a pregnant person are kind of seeking this care and willing to go that extra mile, I'm sure if you advocate for yourself, you will be able to, find a midwife and also see if you can work in a hospital setting, give birth in a hospital setting rather, and, still have that kind of motherly care, that loving touch, that respect and that compassion, along with having all the, clinical facilities available, right down the hall if required.
If somebody is open for a home birth, right? The first question that I got, at least when planning for home birth, is what if something wrong happens?
Goes wrong. Yes.
Goes wrong, right? And how do you handle that? So can you please talk about that a little bit?
This whole idea of things going wrong, right, is somehow rooted in, the fact that our bodies are broken and, they're not functional, or there's so much focus on ensuring that nothing happens to the baby that we lose sight of the big picture many times. In media, everything, usually if there's a birth scene that we see unfolding, all hell breaks loose. It's very chaotic and, it's something dangerous is about to happen. So what I'd like to say is that birth is inherently safe. It's not dangerous. Okay, yes, there can be some complications, but I think we should differentiate between complications and emergencies, right? A complication is where, yes, things are not normal, but there's almost always enough time, sometimes hours together. There's nothing, there's no emergency or there's no life-threatening situation that's happening to both the mother and baby, right? And that's the beauty again of midwifery care, because we are providing such hands-on care where we are so present ourselves to make sure that both the mother and baby are fine. We can actually very easily pick up any of these, yellow flags or pink flags before they become red flags, right? Of course, if you see a complication and don't do anything, yes, it can become an emergency. But as a midwife, that's one of the things that's always running in the back of my mind. Is the mom doing okay? Is the baby doing fine? Then I'm sitting on my hands and smiling, right? I'm not trying to intervene in the process. And that happens, I would say, such a huge majority of times, which reaffirms my training and my belief and what many women also believe that it is, safe to birth at home, safe to birth in any setting that they choose, as long as they're choosing it consciously and they know what they're choosing and they know what kind of support is available, right?
We also had a plan B, right?
Yeah.
What if actually something goes wrong and you think that before becoming a red flag, we had already decided on the nearest hospital close by that we could possibly go through, if at all that stage comes, right? So mentally also I was like a little bit more calmer.
We always tell mothers who are choosing to birth in an alternative space where there is no obstetrician or there's no operation theater available in that setup, that you have to know where you would go in case there is a complication. Okay. And if at all there's this situation where you have to transfer, right, either the mother or the baby need that extra layer of support, then we know exactly where to go. So this is all very well planned out. It is not ad hoc. This is not like, oh, I'll come rub your back and you'll have your baby. This is definitely not that. It's so much more nuanced. And if we are answering all your questions and making all these, plan A, plan B, plan C, and I don't know, plan 100 also I have, plan Z also I have in my mind, right? And we discuss everything with the parents, because it is their birth and it is their baby, so they need to know everything, right? So it's not like I'm attending 100 births per month. That's physically just impossible for me to do. So I take on only 8 to 10 clients per month, where I can give them my undivided focus and attention.
Can we talk about pain during labor?
Oh yes. That's my favorite topic.
I gave birth. I had heard of like how much it pains and it's like intolerable and like things like that. So can you talk about the pain during labor, and also if you have any natural alternatives to pain management?
It's painful. Yeah, I'm not going to mince any words. It's painful, but you did it, right? I did it. I know so many women, millions of women out there who have done it, right? So it's a part of the whole process, right? And the fear aspect has just been brought about by people who don't actually understand why that pain is there. Okay, pain is a signal that our body is trying to tell us something. Okay, pain is a signal that things are changing in our body, so that the baby is going to get lower and lower in our vaginal canal and be born. How you manage the pain or how you cope with the pain is what is important, and that's where so many things come into play. Having a relationship with your care provider, like a midwife and her client, we always have a relationship with each other. We have become good friends now. Right?
Can you talk about, because I don't think people would understand unless they have gone through this process.
Exactly.
What does having a relationship mean? Like, even if you're my best friend, how does that change me, going through labor in a different way versus like somebody else?
So your nervous system can really calm down. Right, like your husband, right? Arnav was such a big part of the whole process. He never left your side. He was there. So every time you looked at him, it was something very familiar, because you guys have a loving relationship. That the relationship with your care provider, that is your midwife, that goes a long way. So this 9 months, 10 months of these regular meetups, having classes together, answering the questions. Sometimes we talk about things unrelated to even birth, right? So what that basically does is, when you do actually go into labor and have the pain and have the contractions, some part of your brain is like, oh, I am safe, right? Because the person who's going through labor needs to feel safe, okay? And that's very, very important. And then, of course, we also, not just the people, that's definitely a very important part of the whole coping mechanism, but the environment, right? Like the dim lights, the calm music playing if you love music, the different positions that you can be in. Like you have complete freedom of movement. As a midwife, like I have like hundreds of little tips and tricks that can help you. And these are things we don't just throw at you during labor, right? We discuss it much before in pregnancy. There's so much that goes into preparation, okay?
Right.
At the end of the day, it is an experience, right? As you were actually saying before, that you look back at your labor and birth with fond memories. You don't think about the pain, and that's actually the experience of every woman who's gone through labor and birth. They're not actually remembering the pain. What they remember is how supported they felt, what their environment was, where they, did they feel safe and comfortable. Right? And also the other aspect I want to really talk about is it's not like a continuous pain that you're going through. There's almost always enough breaks, right? There's just this one small part of labor called as transition, where it does feel like the pain is quite intense and it's almost continuous. But even then, there's like 2 to 3 minute break, I would say, actually. So the body is always balancing, because actually with every contraction is when the woman feels the pain, and there's also reduced blood supply to the baby, right? So it can't just be like continuous pain. Then there's something not right about the situation, right? So the uterus contracts and then it relaxes, contracts and it relaxes. So it's good for both the mother and the baby to get those breaks in between. And one of the techniques we talk about is to live in those breaks, right? And as women, we can do hard things. We have been told and conditioned that we can't do hard things, but we can actually do hard things.
We're also groomed in a way by the medical system to believe that we need more than just ourselves. And what I realized through midwifery is the fact that my body is capable of giving birth. And I remember my contractions, with every contraction, because I was aware of what was happening with my body, that the baby was coming down and closer to me. Of course, it's painful, but I don't remember it being the way that I have heard other people talk about labor.
The hormones that flood your body just after birth actually make you forget the pain. That's it's similar to like climbing Mount Everest, right? So birth, I would say, is like climbing 10 Mount Everest. So as women, we don't even have to train to climb Mount Everest. We do it all in our body. So how amazing is that?
Right. We spoke about how the environment needs to be safe. So who, according to you, should be allowed in the delivery room? The friends, family, husband, parents?
I think that's a question for the woman who's giving birth, really. It's very individual choice. As a midwife, I would like to meet everybody before we are in that situation of labor and birth, so that everyone knows what to expect. Because when you see your loved one in pain, it can be quite shocking if you're not prepared. So I think we do a lot of work in pregnancy to ensure that everyone is prepared, to whatever extent possible.
Can you talk about one powerful thing that you have witnessed a mother discover about herself during a natural birth?
Oh my gosh, this is like when you see the look of the mother lifting her own baby up into her arms, up to her chest. I think that's like, goosebumpy, unforgettable, because she stands there in her power, where she's surrounded by all these people who are cheering her on. We are all her cheerleaders. And she's like, I did it, right? It's just that feeling, like a lot of people can relate to climbing on top of a really big mountain and putting a flag there and feeling that euphoria. I think birth has that similar euphoria when you feel really supported, right? That my body is capable, my baby was amazing, and this just happened. I not only grew a baby, but I also gave birth to that baby.
It just feels so good, Cheta. I don't have words to
exactly. It's an experience. So I think this is really an invitation for everyone to explore midwifery care. I'm not saying that you should choose. Everyone need not choose it, but I feel very strongly that you should at least explore midwifery care if it's an option for you. Definitely, even if it's not an option for you, because I know people who have traveled thousands of kilometers to experience midwifery care because that's what they wanted. And I think everyone should be aware of this, and that's really my hope, that we have like thousands and millions of midwives, so that every woman gets this kind of care that they deserve.
I think birth is such a strong and powerful time of your life. It can either be the most transformative part of, or rather the best thing that you could ever have done, or it could be the most traumatic experience you've had.
Yeah.
You know?
Yeah, I would say it's a range, right? And most people fall somewhere in between, where there are some good aspects of what they experienced and some traumatic aspects also. But yeah, I think when you have that team and when you have that kind of, like when you have midwives basically, it can fall towards the good side of the spectrum.
Right, for sure. Beyond delivery, what kind of postpartum support do you offer the mother and the child?
As a midwife, I do provide 2 months of postpartum care, where it's care for both the mother and baby, right? So apart from vaccines for the baby, all the care is something that I do take care of.
Okay.
So with respect to jaundice management, apart from that, breastfeeding support for both the mother and baby, right? What position the mom can be, how is she comfortable, how often to feed, how do you know that baby is getting enough, right? How to get rest when you are constantly having to nourish and nurture this baby. Actually, many times I do get calls from mom at 2 in the night saying, oh, my baby is not latching, or you know, he's not drinking, he's just sleeping, what do I do? So we are what we say on call support. So we do answer all those questions as soon as we can get to it. And you know, we do also provide in-person visits and many times home visits, because that's convenient, right? When you've just given birth, you don't want to get up and go and sit in a doctor's office for like hours together in the clinic. The other thing is weight gain for the baby. Is the baby meeting their age appropriate milestones? With respect to the mom, it's a big period of hormonal shifts for her. This is where, you know, continuing to have that support is very, very important, where she feels that she can continue to ask questions. And, you know, it's also a time when everyone is telling her 10 different things or 100 different things. And, you know, sifting through that knowledge when you're newly postpartum can be very daunting. So when you have a relationship with your midwife, you know that she's giving you evidence-based information.
I feel like formula marketing is making Indian moms think that their breast milk is not enough. Something that I personally have gone through, right? People continuously asking me, okay, so when are you starting formula?
Your baby's so thin.
Your baby's so thin.
Tell me about it.
So and a lot of mothers watching, please, can you talk about especially demand and supply and how that works?
I think this belief that your milk is not going to be enough is very entrenched, right? And it kind of is the same concept that our bodies are somehow not capable, or they're just capable of giving birth, and after that somehow they stop working like they should. And it started with a lot of the marketing, as you rightly said, in the 60s, late 60s and early 70s, when the big formula companies came on the market and started saying that this is the best way to you know, feed and nourish your baby. And everyone somehow got hooked onto it with that belief that, you know, formula is somehow better than breast milk.
Correct me if I'm wrong, but by feeding formula, generally the babies become a little bulky.
Chubby? Because you know, the stomachs, all our stomachs are the size of a fist. Okay, and the babies, you have seen your baby's fist; it's so tiny. So when we bottle feed, especially formula, we can overfeed them, and when we overfeed them, our stomachs can expand. So we are setting them up for the risk of, you know, obesity and lifelong illnesses associated, you know, lifestyle diseases like diabetes and hypertension and all of that.
Thank you for saying that on camera.
Yeah, because it is something that is not known, and you know, all the aunties and the grandmoms, they're all very well-meaning. But at the same time, it's just this message that has been constantly drilled into our heads that somehow we are not adequate. So the breast milk, it's actually a live fluid. It has a lot of live cells, and it changes according to the baby's age, the baby's needs, right? The baby's needs are different in the morning, especially when the baby falls sick. Breast milk also provides immunity, right? So those are all things about breastfeeding and breast milk that is rarely spoken about, because the formula companies have done such a good job of driving it out of our you know, consciousness.
Right. Nirvan is sick today, right? And when I was feeding him, I knew that my breast milk has changed because of his saliva,
Right.
telling my body to produce certain, antibodies. So even small things like this, Chetna, it makes so much of a difference.
Yeah.
And I know that he's getting better, and what better medicine than my breast milk for him.
Exactly. Yeah.
Somebody who's wanted a natural birth, and for the doctor to say that, oh, we have to go for a C-section because I have a couple of scenarios. If you can walk us through,
Sure.
if they are true or false.
I would love to do that.
Okay. If you have a big baby, 3.5 kgs or above, and the mother is very lean, right? She can't have a vaginal birth.
It's false. Lean, short, too tall, too narrow a hip, too narrow a pelvis. If you see the evidence and the research, there's nothing supporting this. In fact, genetics plays a big role in the size of your baby. Also, your nutrition throughout your life, not just in pregnancy. Of course, in pregnancy, it makes a much bigger impact. Those do have direct influence on the baby's size. But it's actually the baby's position that matters in labor and birth for it to unfold naturally, and not really the size of the baby.
Baby's heart rate is dropping. We need to do a C-section.
Dropping when, dropping how. So there are so many nuances for it. Definitely, this is something that needs to be taken seriously. So there's a normal range in which the baby's heart can, it's variable, the heartbeat for everyone, right? So every beat is a different number depending on what is happening. Okay, and there's a range which is normal. When babies do, the heartbeat goes below the range of normal, that many times may not be a normal scenario.
Okay.
But sometimes it can actually be normal if the baby's head is getting compressed. Okay, so what you're talking about is fetal distress. So whenever I've had fetal distress in my practice, we don't immediately, rush off to a C-section, depending again on what's happening. So there are some things that we can do, like change the mother's position. Sometimes it's the umbilical cord that's getting compressed between the baby's head or a bony part and the mother's pelvis, bony pelvis. Okay, so just shifting her position sometimes can, help the baby recover.
Okay.
The other thing that we do is give resources to the mother. So the baby's heart rate is many times it's dipping because the baby is running out of resources.
Okay.
So when we give resources to the mother, such as IV fluids, so we run IV fluids is basically the drips, right? So we give her drips and we run a certain amount of fluids at a certain rate into her body. So that gives her energy, right? And when it gives her energy, it gives the baby a chance to recover.
Okay.
We use oxygen to help the mother oxygenate the baby.
Okay.
So those are things that we do. And then if we still see that the baby is not recovering and saying that, no, I'm kind of done with this whole process, which sometimes babies do say that, then we would say, yes, a C-section is required at this time to help your baby, come out.
Okay. Umbilical cord is around the neck of the baby. We need a C-section.
It's a false. I've attended so many births where there are at least like 1 or 2 loops, and sometimes I think I've attended one birth where there were 4 loops of cord around the neck, which the mom herself, unwound after the baby is born. So the cord is pretty long. It's got a gelatinous substance called as Wharton's jelly. Okay, so it has 3 blood vessels and Wharton's jelly. It can wrap around the baby's neck. It can wrap around the baby's hand or leg or some, abdomen or something. It doesn't matter where it wraps around. And this is detected only through an ultrasound scan. So when you go for the scan, this is how your baby was. But that doesn't mean that your baby is not moving. So babies constantly rotate. Once they are in the head down position, they keep moving around. So then it can, be uncoiled during the time of birth. So that in and of itself is a reason for major abdominal surgery? No. We can't measure the length of cord, ultrasound scan. So if at all baby is having distress, that is the fetal distress, the heart rate dipping situation, then it could be because of a tight cord, and then you do a C-section.
Okay. Our baby has pooped inside. We need to do a C-section.
everyone's scared of the poop, but we need to understand that meconium, or the first poop that the baby takes, is mostly dead red blood cells and a little bit of other waste products which can't go through the placenta into the mother's bloodstream to be filtered out. That goes into the intestine and sits. Baby pooping could just be because of the contractions, could just be because the baby is really healthy and having a full bowel during labor. And in and of itself is not a sign of distress.
Okay.
Right, so the heart rate is what we want to focus on. So even if the baby has pooped, and the only way we can make out that the baby has pooped is if the amniotic sac releases and the waters break, and we see the leaking and then we see the color. Okay. So again, depending on the color, we can make decisions, and we do keep a closer eye on the mother. And again, our moms are all very well informed about what really it means to have meconium in the fluid. I've again attended many births. In fact, both my nephews had pooped during labor, and they came out just fine.
And it's a breech baby. We need to do a C-section.
I would say false. Again, breech is a variation. It's a variation in the position of the baby. It means the baby is not head down like most babies are, but it's actually bum down, right? And it does come with its own complications, but if the baby is full term, that is beyond 37 weeks and really healthy, and there are no other complications per se, then we do have a very detailed conversation with the parents. Breech vaginal birth is a skill that most obstetricians nowadays don't have, because it always means let's go for a C-section.
They go for a C-section not because it's necessary, but because they are not equipped to do.
They're either scared or they don't have the skills to support physiologic breech. And that's something that a lot of midwives do have, that skill to support normal breech births.
Okay. Last one. The labor was going on for a long time. So the doctor asked me to do a C-section.
So this
long time is maybe 24 hours.
So this is, I've heard, long time even being 6 hours. So it's really, the definition is so varied, right? As a midwife, I have a lot of patience in waiting for labor to unfold. So what we are, again, as a clinical skill of mine, one of the things that I do assess is labor progressing. Okay, so for a first-time mom, it might take a lot of time because, her body is doing it for the very first time. So as long as there's progress, and as long as the mother is able to keep up her energy and her blood pressure, all her other vital signs are normal, the baby is sounding great whenever we listen to baby, there's no reason to change course and do something different. Right? Hospitals and doctors, unfortunately, it's just the system, right? How it's set up. So they don't have as much patience to wait for it to unfold. And sometimes labor can also take time because of the baby's position. So we do a lot of acrobatics, like I call them, or exercises in labor to get the baby in a good position, and then birth can take off, like labor can just take off like that, right? So it really again depends on the situation, and what is typically a long time in the definition of a hospital system is not at all a long time in midwifery care.
What's one thing about natural birth that you wish every single pregnant woman knew?
We have all the inbuilt tools. We need to learn how to trust ourselves and trust our intuition, the messages that our body is sending, and that somehow is lost along the way. So go seek a midwife and learn how to, listen to those voices that your, body is trying to tell you.
Amazing. I really wish that this episode reaches as many mothers as possible. And honestly, Chetna, I can't tell you. And every time I talk about it, I get so emotional because it has changed not only my birthing and pregnancy journey, it has changed my life, of how I look at my life. I've become so much more confident, and it is possibly the best thing that I have ever done in my life. I would request everyone to get in touch with a one-on-one consult with you. How do they get in touch with you?
They can find me very easily on Instagram. I go by Your Bangalore Midwife. I also have another page called as Giving Birth in India. So both those are very accessible. They can get in touch with you and you can give them my phone number for sure. And thank you so much for having me on your podcast and for all the passion that you bring. It feels great to have this sort of community and this support, and for parents to actually recognize what I do, because I'm doing it for you all, really, right? And I really hope that we can change birth for the future generations.
I hope so.
Yeah.
Thank you so much.
You're most welcome.
Okay, come. Push your bum back. I think that should do.
Yeah, these two are not helping. Oops, I shook the mic.
No problem. Yeah. Whenever you're ready. Okay. Can we start?
Okay, cut and roll.